All right, now we move Christina out here a little bit. This is one of our therapy tables in our therapy room here. I wanted to show, it's easier to show out here some of the cervical and the shoulder stuff that we're going to do. Again, this isn't the only way to do it. This is the one that we do a lot in our clinic, and I'm just showing you the ones that we know work and that we're comfortable doing. So Christina's laying on her back, so we're going to assume that she has some tight posterior cervical extensor muscles that are leading out into the trap and into the shoulder. Not a torticollis syndrome, but she has a lot of tautness, woke up with a stiff neck, so we're going to do some ART and some passive stretching on trying to release some of these. So first of all, if the muscle's been tight for just say 24 hours or more, you're probably going to have a little bit of subocciput tenderness, so it may not hurt for you to do some cupping under the subocciput, and you'll feel like little balls, little trigger points under there. Just kind of hold those and release those. Now you can also do a 2-point touch, and I'm going to get into that in the next video, what I mean on that, about dual point release. So we just assume she didn't have those. If she did, we would have worked them out. So now we're going to stretch our posterior cervical extensors and some of our scalene muscles in the back here, then the trap. So first of all, I like to have the patient totally relaxed. I like to do this seat laying down. It's better for you guys when they're on the massage table anyways, because it's going to be laying down. Some of them we can do in the chair, and Christina does do some of the stretching in the chair. But I like to have a firm hold. I got her head right in my hand, right below the occiput. And all I like to do is, first of all, just get her range of motion. I'll passively go through the range of motion. And what I'm doing is I'm not just looking for joint play here. I'm feeling with my hands, as I'm going near the end range of motion, I'm feeling muscle contraction or spasticity or any fasciculations, because that'll give me an indication the muscle isn't working properly. It's having proper in-firing patterns, and we'll need to work on those, re-muscle train. But right now, say she's doing good. We're going through pretty close range of motion. I'm not getting a lot of firing pattern, but I am feeling it stiff and starting to guard. I keep pulling your hair, sorry. So what I would try to do then is with one of my fingers, normally my index finger, I'll grab the muscle right here and I'll push up toward the subocciput, right up toward the occiput bone, and I got that muscle anchored. Then I'll take her shoulder and I'll push downward. Now, I will push downward and I'll actually feel it pulling on the muscle under my finger. When I do that, I will bring the neck up and slowly rotate away until I look for one of 3 G's, a grunt, a groan, or a grimace. When I see one of the 3 G's on her face, I know I got her in range of motion. And then I will hold it there, okay? Now, the other thing we can do is an active release is we'll hold it to the end, and then I'll have her raise her shoulder up. Go ahead and raise your shoulder up. She's going to do that motion, go back to normal, but I'm going to resist it. At the same time, I'm anchoring the muscle. So I'll tell her do it again, and I'll resist. I'll tell her relax. Then we'll stretch a little more. Raise it. I'll resist. Then we'll stretch a little more. I normally do that a sequence of 3 times. And what you'll do is you'll have the muscle, you'll start to get it to contract, release the calcium supplies, it'll start relaxing a little bit more, then you can go a little bit past the end range, okay? Again, always watch for the 3 G's. I see so many people, doctors, physicians, PTs, massage therapists, looking away as they're doing this and they're not watching the patient. Look for the 3 G's, grunt, groan, or grimace, and you'll know when you're getting near the end range and it's discomforting. So that's another tip. I'll be throwing more your way.